Breast and cervical cancers are among the most frequent and most fatal cancers in women. With early detection, it can be curable, but access to screening is one of the many problems patients face. To ensure an improvement, the Lagos State Ministry of Health trained health workers on better and adequate services to ensure a reduction in deaths. Inoluwa Popwola reports.
From the early to the advanced stage, cancer is one of the most chronic diseases that happens with abnormal cells growing in the body. For women, the majority of cases are breast and cervical cancer. To bridge the doctor to patient ratio, which currently stands at 1 to 6,000 ratio, the Lagos State Ministry of Health with the United Nations Population Fund are training about 200 health workers on how to create better access to screening services.
The leading causes of cancer mortality in women are just the breast and the cervix, and we are sure we are dealing with. And if we can tackle this, then we are sure that our women will live longer, will be able to protect and provide for their families, and will also have affected a lot of other targets on the SDG.
Healthcare workers are with a relatively high level of cadre, not necessarily the doctors or the nurses can be mentored, can be trained on the basics of how to screen clients so that we can fill the gap.
With the increasing population, there is need for sensitization on how to practice self-examination and detect early signs.
We can't really say that you can totally prevent it like that. But we always say that the best way to actually prevent having cancer is to screen, and screen early. Screen regularly and screen early. We have 15 general hospitals, and then we have our tertiary facility, LASUS, providing these services free of charge.
The participants also had a practical session that would ensure a better practice going back to their various centers.
Every woman that walks, every female that walks into the facility, that we should ensure that we screen them.
Breast screening, for example, which has to do with telling our clients to do self-breast examination.
With recent efforts from the Lagos State government to make cancer screening more accessible, it is also focused on the aftercare services to ensure an overall quality healthcare experience. Inoluwa Popwola, TVC News, Lagos.